Okay, I'm back. This lecture is going to be on chapter 42 in your textbook, and we're going to start, this series is going to be on musculoskeletal disorders. So the bone conditions, bone trauma, and the connective tissue issues, like your tendons and ligaments and things like that. So the first thing that I wanted to talk about, and there's some stuff in your textbook that is just, you're never going to see it, but I wanted to highlight some of the stuff that you will see and that are major problems in the United States. You're probably going to see some of these issues. The first thing I wanted to talk about is low back pain. Tons and tons of people have low back pain. And by low back pain, I mean in the curvature of the spine. And a lot of people get pain here because of improper seating, or they bend over and they're not using the good mechanics. As we've taught you since like Nursing 101, it is essential that when you are lifting patients, rolling patients, that you're not using the these ligaments in your back, that you're using the big leg muscles. So if you're going to bend down and pick something up, move something over, you're actually going like you're keeping your spine in alignment and you're moving your legs like this to lift. That's going to prevent all kinds of low back pain. Nurses are very, very high risk to developing low back injuries, and it's because we're constantly moving patients, heavy loads and things like that. So as a nurse, you need to be careful that you're protecting yourself so that you don't have low back injuries, and that you're also teaching your patients how to avoid low back pain. So step one, good lifting techniques. Step two, good ergonomics. So when we're talking about good ergonomics, you're going to want to teach your patients how to sit well when they're sitting up. When patients are slouching like that, you can see what it does to the spine. And this is really why there's a lot of pain in the lower back, is because of the stress that people put on the spine because of poor ergonomics, poor body positioning. So if a patient has low back pain, first of all, assess how they're sitting. This is a very common position for people who are like young kids who are video gaming and stuff. Young kids can sustain this for a long time, but as we age, it gets harder and harder, and these kinds of improper positioning can lead to low back pain. So you're going to want your patient to sit in this seated position. So if your patients are complaining of low back pain, or if they've had a previous low back injury, I'm not including spinal cord injuries in this, I'm just talking about strains and sprains in the big muscles that go down on either side of the spine in the lower back, you're going to want to teach them to sit like this. They should be seated in a hard chair, preferably with armrests. This would be even better if there was an armrest that the patient could rest their arms on up here. That would be ideal. You want the feet flat on the floor. This is not ideal where they've got improper feet. You want it flat on the floor. And what this is doing is aligning the spine. You can put a soft pillow in the curvature of the spine. You don't want anything hard in there that's going to jam that spine out, but just something soft that's giving some low lumbar support. This is the ideal position for somebody who has low back pain. Other things that you can do is you can alternate between rest and ice, and we would treat low back pain as if it were a sprain or a strain in any other joint, like in the wrists or the ankles, and we're going to talk about that a little bit more in chapter 43. I've got one slide at the end of this lecture that I'm going to show you about, but basically it's going to be a RICE: rest, ice, compress, elevate. And with the ice piece, after the first 28 to 48 hours, where you just keep ice on it because of the inflammation, after that, when it's more of a chronic condition, you can alternate between ice and heat and ice and heat. So that will help in somebody who's got some low back pain as well. So step one, you're going to want to prevent it, and you're going to sit with the butt a little bit tucked under. So you want to tuck that butt a little bit, and it's going to pull this spine down just slightly rather than like shoving that butt out. You want to tuck it under. And then you can always have the patient take a little bit of NSAIDs or Tylenol or something like that for the pain. But really it's prevention first, and then good body posturing. The other thing is this is really blurry, but it gives you the sense of what I'm talking about. Body positioning is really important in the prevention of low back pain. So instead of reaching over and grabbing a box or a heavy thing like that, which is a very common cause of back sprains and back injuries, you're going to want to teach the patient to lift with their legs. When you're standing, when your patient is holding something heavy, or when you as a nurse is holding something heavy, you'll hold it closer to your center of your spine rather than out here. When you're holding something heavy out here, it's going to put a lot of pressure on that low back. Again, when they're sitting, you're going to want to sit in an upright position. Arms are supported, feet are on the ground. When your patient is laying down, patients who are in bedridden for a long time will start getting back discomfort because your body is not meant to lay down for a long period of time. So a supine position is much better than a prone position. When the patient is in a prone position on their face, that extends the legs and tends to accentuate the low curvature of the spine, putting more pressure on that spine. So prone position is not good for somebody who has back problems. Supine position, support the knees with a pillow, feet are flat, and a small pillow under the head. This, like completely flat like that, is going to put too much pressure on that lower back. And if they're going to be on their side, a side position is fine. You're just going to want to support the top of that spine with a pillow. And if you're standing up, which standing is great, we tell everybody who's seated for too long to get up and move. We don't want anybody immobile for too terribly long, but have them stand up and then support with those feet if they have to be in a standing position. So those are just some rules of thumb for low back pain. The next thing I wanted to talk about is osteoporosis. Osteoporosis is super common in the United States. It gets more common as people age. As people age, this is a normal bone and it's nice and tight and compact. But as people age, they can tend to develop osteoporosis. Osteoporosis is one of the leading causes of fractures. So in your patients who are developing this, it is a huge nursing priority to prevent fractures. So and the way that you do that is prevent the elderly person from falling. Because if you compare these two bones, if this person falls, the chance of them of fracturing a hip are small. This is why little kids fall down all the time and they're not getting hip fractures. But in the elderly, as this bone starts becoming more osteoporotic, you can tell if this person falls, their chance of fracturing that hip is much more likely. If an elderly person fractures a hip and they end up in the hospital, there is a high likelihood that they will develop pneumonia, and it's actually one of the leading causes of mortality in the elderlies because they can't get out of the hospital because of the pneumonia, and then they just deteriorate. So we really need to prevent this. This is another example of osteoporosis. This is your normal bone. This is as we age, the osteoporosis starting, and this is severe osteoporosis. So you can see as the osteoporosis progresses, the likelihood of this bone fracturing with very minimal impact is high. So there's a couple things that we want to do to prevent osteoporosis from occurring in the first place. What happens as people age is the formation of the bone starts slowing. This is more common in women. It's more common in women that have experienced menopause. And so we start watching for this in all of our elderly patients, but especially our females who are in menopause. And by menopause, I mean they have not had a period for at least a year. So this is going to show up in women that are about 50. 50 is like the normal age of menopause to occur. So anywhere between 50 and 65, and then beyond that is they're really at risk for developing osteoporosis. So the ways that we prevent this is in high increased calcium. So we're going to want our patients to increase their dairy, milk, cheese, yogurt products. We're going to want them to increase their vitamin D intake, and that's easy pill that a patient can take over the counter. We get a lot of vitamin D absorption through the sun, well obviously in Michigan and especially in fall, winter, we don't have a lot of sun in Michigan, so you need to get it somewhere else. And so you can just get the little over-the-counter tablets in the vitamin aisle. So your patient should be on a vitamin D, usually at least 400 international units of vitamin D a day. The other thing is a nutrient that they can take is biphosphates. A biphosphate is a very simple nutrient that a patient can add to their diet. They can have estrogen replacement. So as a woman starts going into menopause, a lot of them will go on estrogen replacement therapy. That will help slow down osteoporosis. Weight-bearing exercises will help keep this bone intact. So you're going to want your people to start walking, getting some kind of weight-bearing. Walking is the best one. Swimming is a good exercise, but it's not weight-bearing. So if they're able to bear weight, we really want them to, get out and go for a brisk walk. The other thing that can cause this is your patients that have thyroid problems, because if you'll recall from our endocrine conversations previously, the thyroid is responsible for releasing calcitonin. Calcitonin helps to, it decreases the calcium that's in the blood by improving the uptake in the bone, and you want that. So the levels of calcium in the blood, which should be about 8 to 10.2 or something like that, that's about as much calcium as we want in the blood. And then when calcitonin produced by the thyroid is circulating in the blood, it will identify, oh, there's too much calcium in the blood, and it helps absorb the uptake of calcium in the bone and maintain good, strong bones. So calcitonin, one, it's a produced by the thyroid, but you can also get supplemental calcitonin. Like you can put a person on calcitonin as a medication if you think that they need to increase calcitonin levels. I wanted to talk about some risk factors for developing osteoporosis. The list is huge, but it's important. So if you're patient or you have a family history of osteoporosis, your patient's more likely to develop osteoporosis. So if you're dealing with a woman who's 50 and you're taking care of her mother who's 80 and her mother's in the hospital because she's got osteoporosis and she fell, she broke her hip, probably ought to talk to that woman about some prevention strategies as well. Low calcium intake, people who are lactose intolerant and they're not eating a lot of calcium, high risk for developing osteoporosis. People who have a lot of caffeine, who drink an excessive amount of Diet Coke, coffee, things like that, are at higher risk for osteoporosis. Tobacco use, people who smoke are at high risk for everything. This is why everybody should not smoke at all. Cushing syndrome, we talked about that with endocrine. And those are the patients who have moon face, high levels of aldosterone, their adrenal glands are hyperactive. Those patients are at high risk for developing osteoporosis. And the reason is because they have high levels of natural cortisol. Their adrenal glands are in overdrive. That feeds right into here. Patients who are also on long-term use of steroids, both of these things, steroids, long-term use of steroids and bones don't get along. It will lead to osteoporosis, which is why you don't want your patient on corticosteroids for very long. That and a litany of other problems with it. Patients who are immobile. When your patients who are immobile, they're not moving a lot. This is true with your spinal cord injury patients, your bedridden patients and stuff. What happens is the bone actually starts to demineralize, and the calcium that's in those bones will start seeping out and oozing into the bloodstream. The kidneys and the gut are pretty good about getting rid of extra calcium. So when the GI tract and the kidneys identify that there's higher levels of calcium, they can start secreting, getting rid of some calcium, but that doesn't do anything for the bones that are actually losing the calcium. Hypothyroidism, we just talked about. If your thyroid is not working and the patient is not producing enough amounts of calcitonin, that's another reason that your patient can develop osteoporosis. People who have eating disorders or maldistribution syndrome, Also, those patients are at high risk for osteoporosis because it is really very closely associated with nutrients. So if your patient's not getting good nutrients, especially vitamin D, calcium, and some of the other bone-forming nutrients, and they're going to be at higher risk for osteoporosis. Breast cancer, and again, this is a little bit related to some of the estrogen components of osteoporosis, especially if the patient is being treated with chemotherapy, because the chemotherapy is going to suppress the estrogen, and you need that to treat the breast cancer, but that is going to have a significant side effect of osteoporosis. So it's something you've got to keep in mind. Obviously, we're going to have to treat the breast cancer, but you're just going to watch this patient for osteoporosis. You're going to do bone density scans, really a great scan now, an easy scan to figure out if somebody's got osteoporosis. And you're going to want to start doing things like we already talked about to prevent that from happening in the first place. Renal or liver failure is going to lead to osteoporosis, alcoholism, people who are lactose intolerant, that kind of goes back to the low calcium intake. And people who just have deficiencies in their diet, especially of vitamin D and calcium. So 1, you watch for risk factors. 2, you diagnose it like with a bone scan and with a good history. Another thing that you can watch for is your patients, and you've probably seen this like with your grandmas and stuff, they shrink. They're starting to get smaller and smaller. You know, like your mom was probably your same height, but then as they age, they're getting smaller and smaller. And the reason is because of osteoporosis in the spine. So it's starting to reduce the strength of that bone. So how do we treat it? What do we do for osteoporosis? 1, prevention. Like we already talked about. If you forgot, go back and listen to that part of the lecture. 2, increase the calcium, the vitamin D intake. They can have oral biphosphonates. That's really the first. These are like supplemental nutrients that a person can take. You can get them in your diet, but you can also get a supplemental nutrient of these. Calcium is easier to ingest than vitamin D, which is why we usually recommend that patients take supplemental vitamin D, especially in Michigan because we just don't have enough sunlight. You can also take the oral biphosphonates. That's probably the second line and easiest medication to take, so patients can start on that. If they are going through menopause, you can then replace the estrogen. There are some side effects of that. There's some studies that suggest that it might lead to some breast cancers. So there was some controversy about that. So this one is a little controversial, but a lot of people who are going through menopause go through estrogen replacement therapy, which really helps with some of the menopausal symptoms. If the patient is still developing osteoporosis, the disease is still progressing, then you can place the patient on supplemental calcitonin. And like we already talked about, it's a natural calcitonin, and you can place them on a supplemental calcitonin, which will pull calcium out of the blood vessels and increase the uptake in the bone. Like I said, there's a huge risk for fractures in patients who are developing osteoporosis. It's easy to see why. So as a nurse, obviously you're going to want to prevent this. You're going to want to get rid of area rugs in their home. You're going to want to make sure that they have rails up and down stairs. They've got safety devices to get in and out of bathtubs, things like that, because you really want to prevent them from falling. Good lighting, good leather sole shoes, things like that are going to help the patient not fall in the first place. Okay, so that's it with osteoporosis. Let's talk about osteomyelitis. Osteomyelitis is not super common, but it is an infection in the bone. It is really hard to get an infection in the bone. You don't have a ton of blood supply to the bone, although you'll remember that the bone marrow is responsible for producing some of the red blood cells, because your bone marrow produces blood cells. But the lack of blood supply to the bone there's not a ton of it. So once a person gets an infection in the bone, it's very difficult to treat, because if you've got an infection somewhere else, we will give you an oral antibiotic and it will get in through the GI tract, or if it's severe enough, we'll give you an IV antibiotic. And the antibiotics will get into the bloodstream either through the GI tract or the IV, and it works really well. Well, what happens if the bloodstream doesn't get to the organ, like the bone? There's not a ton of blood vessels in bone. So once the patient gets an infection in the bone, it's really difficult to treat and can create quite a few complications. So this is a bone without an infection.